Hi, my name's Rena Sorenson. I'm a respiratory therapist. I've been doing that for over 20 years. I'm based out here in Ponoka, Alberta, and I'm coming to talk to you about seasonal allergies today. For those of you who have seasonal allergies, you understand the horrible itchiness, the redness, the swelling, the dripping. It can be very annoying to have. Seasonal allergies are the same as any other allergy, and it's about histamine release in your bloodstream. How that is experienced depends on the body part. So if the reaction is in your eyes, there's a lot of watering and very, you'd rather take your eyeball out of your head and scratch it and then put it back in. It's severe. The way it manifests in your lungs is a little bit different. So the airway of our lungs, it's got a nice clear airway that air can move in and out of. It's easy for air to get in and out of that airway. There isn't anything blocking it. The muscles around it are nice and relaxed. There's nothing angry about that airway, and that's how a normal lung looks. Now, if we release histamine into the airway by reacting to something that we're allergic to, the airway gets quite inflamed. All the tissue around that airway swells right up, and you'll see that there's mucus inside. So the way that your eyes will run with lots of water with an allergic reaction, in your lungs, the way that works is that you've got extra mucus, extra swelling. The airway it's too thick for air to pass through easily. And the other thing that happens is that these bands of muscle that are around the airway tighten up like this. It's like a circle that gets smaller and it closes around that airway. So it becomes very difficult to move air in and out. Other, allergies could be hives, could be severe itching. It depends on where you're reacting, but histamine kind of does those same things no matter what part of the body they're affecting. If you have seasonal allergies, it may not be that easy to identify what it is that you're allergic to. It's easy to know you're allergic to cats because every time you pet the cat, you have some allergies. But seasonal allergies are a little different because it's in the air. If it's poplar fuzz and you see that actual, cotton floating through the air, then you can recognize that that's the season or that's what you're allergic to. But for some people, it can be really difficult to identify what it is they're allergic to. So you may need the assistance of, a physician, a respiratory therapist, perhaps an allergist. But it's important that you identify it, or at minimum, identify the season of it. So we know trees have a certain season, right? So it's earlier in the year, April, May. Weeds and grasses, those seasons come later on, May, June. So number one, identify what it is you're allergic to. It's also important that you identify the season by which these things are likely to be in the air. By understanding the season, then you can start to make a really strategic plan about how it is you're going to manage it. Because if you know what you're allergic to and you know when it's coming, then you know what you're going to do about it. And just because it's not May and that's your season to be allergic to something doesn't mean you might not experience seasonal allergies, because we are having problems here in Alberta, in all of Canada, with forest fires. And there's quite a season that comes along with that. And it's not necessarily that you're allergic to fire, fire smoke, but that it's an irritant. So all of us are irritated by the forest fires, but if you have allergies or asthma, it's just kind of an extra level of irritation. You might think that you can't avoid it because it's in the air, but actually you can. There's some things you can do. If you know when the pollen count is high, for example, the Weather Channel has a pollen forecast. If you're willing to dig a little deeper into that app, the Air Quality Health Index will tell you when it's a really bad day outside because of the forest fires. Make sure that you don't go outside that day. Make sure that that's not the day that you open all the windows in the house to air it out. There are some things you can do to limit the amount of allergen that comes into your house. Easy things you can do is to just take a lot of showers. So when you come home from work, if you've been exposed, you've been outside all day, get all those allergens that are on your skin off. Using a furnace that has a HEPA filter system, or using a centralized vacuum system rather than a vacuum that kind of recirculates what you vacuumed up. There are so many options for treatment. Everybody has a different tolerance level, right? So antihistamines, for example, everybody will take an allergy pill, but guess what? There's a drowsiness factor. So if you take the non-drowsy ones, it might not be as effective as the drowsy ones. And that is different. It might work just great for other people. It just depends on the individual, right? So you have to kind of experiment with what's out there and decide what's going to work best for you. I don't know anyone with seasonal allergies that doesn't complain about the eyes, right? The itchy eyes, how crazy it makes them. There's an antihistamine eye drop. You can go to any eye doctor and get them. It's best if you take it before you're exposed or before your body's actually released any histamine, because it's an antihistamine. Same with the hives. It might be a topical cream might be better at managing your severe hives than an antihistamine would be, right? And that you just kind of have to experiment and work through that with your doctor and your pharmacist. If we're talking about asthma, there's a lot of medications out there. It depends on how severe your asthma is. It depends on a lot of different things. So the good news is we have lots of options. The idea with treatment is to find some kind of balance. So as a clinician, what I'm looking for is the lowest dose of medication to keep you as healthy as we possibly can. My idea of a really balanced approach to treating seasonal allergies would include some sort of avoidance and elimination techniques in the home and how you live your life. You're checking the pollen index. Then we would figure out what medications control your symptoms, which ones you're willing to tolerate, which ones work best for you. And then I would take a look at that season. So we would start with inhaled medications, some sort of inhaled corticosteroid usually. So asthma medication, sometimes you have to preload. So you have to take the puffer twice a day or once a day, whatever puffer you're on, but you might have to take it for 4 to 6 weeks before your season starts because it takes that long to get the medication in there and working. And the idea is that by the time May gets here, your lungs aren't going to react. And you take the medication whenever that season is going, and then you can just take yourself right off and not take any medications for the rest of the year. That's a very balanced approach to seasonal allergy management. There are some that are just really severe, right? Really severe asthma, or there's no way you can eliminate how much exposure you get. You can't change your job. Life is complicated. I would recommend that you see an allergist because there's something called allergy shots, and it's very intensive treatment, and maybe you just need to have a little bit of that allergen injected into your body on a regular basis. Believe it or not, this kind of low-level chronic exposure can actually start to get the allergy under control. There's that option, and there's also something called biologics. You have to have a certain kind of genetic pattern in order for that medication to work for you. It's almost like matching you up. So not everybody matches up with that biologic treatment. So if you want to talk to someone who can take a look at what's happening with you and give you some clinical advice, as with everything, you start with your physician. I would recommend that you visit a certified respiratory educator. So most of those would be respiratory therapists, but they can also be a pharmacist or a nurse. Almost every hospital in Alberta has a community respiratory therapist, so you'd have to work through that with your physician, but resources are there. There is clinical support there. The Lung Association has a ton of information online. If you need to know how to use your puffer, you forgot something, if you need to know what to use when, there's tons of information online.